coming through their doors. In Boise, the Veterans Home is so full that leaders there are prepared to bring in a mobile hospital to treat new patients if the need arises. Our veterans, who have sacrificed so much for our country, are at risk of not getting the care they were promised for risking their lives to protect our country and our freedom. I was told a moving story about one of these veterans. He was a 70-something veteran who served America in the Vietnam War. He was a father. He lived independently at home. He walked and exercised regularly. He was active and social. When COVID came, the veteran took many precautions not to expose himself to the virus. The veteran was invited to an outdoor barbecue with close family and friends. He later told his doctors he had some hesitation about going, but decided it would be safe because it was outside and with people that he could trust. The veteran contracted COVID-19 from the gathering, ended up in the ICU at the Boise Veterans Hospital for weeks. He died, isolated due to COVID-19, 1 hour after completing a video call with his family. This healthy man served in Vietnam for all of us. He would have lived longer if it wouldn't have been for COVID-19. Folks, from day one of Idaho's fight against COVID-19, our goal has been to protect lives like this veteran's and preserve healthcare capacity so that each of us can continue to receive ordinary healthcare for an emergency such as heart attack, stroke, car accident, or for routine healthcare needs. We have stated over and over that this is about flattening the curve, slowing the spread of COVID-19. As this chart shows, we managed not only preserve, but to significantly elevate healthcare capacity in Idaho during the pandemic for 7 straight months. Last week, things changed for the worse. Idaho is at a critical juncture. This is unacceptable and we must do more. Today, I'm signing a statewide public health order moving Idaho back to stage 3 of our Idaho Rebounds plan with some modifications. What does that mean? It means indoor gatherings are limited to 50 people or less with physical distancing. Outdoor gatherings will be limited to 25% of capacity. It means distancing requirements are in place for gatherings of all types. It means long-term care facilities will not be allowed to operate without requiring masks. It means we are requiring seating only for bars, restaurants, and nightclubs. It means employers should continue to protect at-risk employees by allowing telework or by making special accommodations for those individuals in the workplace. It means all individuals and businesses should follow recommended protocols for minimizing transmission of the virus. All of this information will be available at rebound.idaho.gov. What this does not mean, it doesn't mean our economy is on lockdown. Our economy will remain open. It doesn't mean in-person church will end. It doesn't mean we're restricting travel in or out of the state. It especially doesn't mean that we should go to full remote learning in our schools. We put millions of dollars and substantial efforts towards the safe opening and operation of our schools to ensure they are safe places to learn and work. The state rolled out a back-to-school framework in the summer, providing local school leaders a blueprint for safe opening. To the school district trustees and administrators who have done a good job of protecting teachers, students, and families, thank you. Our students fall too far behind when they're away from their teachers and classmates. We must continue to prioritize safe in-person learning for students across Idaho. My decision to implement a new statewide order was not made lightly. I want to be very clear about something. the localized approach is still my desired approach in protecting lives and our economy. When Idaho had its first confirmed case in March, we put in statewide measures to slow the spread of COVID-19 while we worked to elevate healthcare capacity across the state. Idaho is expansive, and communities and their needs vary greatly across the state. The eventual shift to a localized approach was the right thing to do, but has not worked as well as it should because the virus is relentless. And in some parts of the state, there simply has been insufficient efforts to protect lives. Local public health boards and locally elected officials have the authority under Idaho law to implement and enforce measures to reduce COVID transmission in their communities. And we have been in regular, constant communication with them about the need to implement local measures where needed. Some health district boards, mayors, and county commissioners have done the right thing and made the hard decisions to successfully slow the transmission in their communities. But there are other parts of Idaho where not enough has been done, even in the face of an overwhelming need for action. The no action approach for dealing with COVID is not a responsible option. I ask my fellow Idahoans, please support those leaders who have acted and communicate to those leaders who have resisted acting that they need to recognize the urgency of our situation for our health, for our economy, and to keep our kids in school. I sincerely hope that some people have passed the point of thinking the pandemic is not real or is not a big deal, or that their personal actions don't really affect anything. We have seen the direct impact between rising case numbers in our communities and the overwhelming impacts on our healthcare system, something that affects all of us, whether we have COVID or not. I still maintain the best defense against this aggressive and damaging virus is personal responsibility and our actions. Wear a mask, watch your distance.
All right, we want to apologize. Obviously, we have our feed has been frozen. We're going to get you back to the governor's press conference as soon as he becomes unfrozen, if you will. But in the meantime, if you're just joining us, we have been, since the top of the hour, showing you Governor Brad Little's announcement about the state moving back to stage 3 in the Idaho Rebounds plan. If we can throw that graphic up one more time, Lucas. I want to show you, basically, it means that indoor gatherings of 50 or less mandated. Outdoor gatherings of no more than 25% capacity of whatever the venue is outdoors. Seating only in bars and restaurants, no standing. Distance required for all gatherings, 6 to 8 feet. Masks required in all long-term care facilities, and again, seating required in bars, restaurants, and nightclubs. Nightclubs can only operate as bars. What it does not ban, it does not restrict travel within or outside the state or into the state. It does not mandate remote learning for students. But again, the governor moving the state back to stage 3, as you probably know, especially if you live in and around Ada County. Ada County has remained in stage 3 since June. The state, meantime, moved out of stage 3 into stage 4 the third week in June. This moves the state back. The governor's saying it's due to the fact that some of the hospitals around the state are close or at capacity. The veterans home in Boise is so full, he says they are looking at bringing a mobile unit in to handle all of the cases, citing the death of a Vietnam vet, a healthy Vietnam vet who attended a family barbecue and died after having a remote call with his family a short while later. So again, the governor announcing that the state has moved back to stage 3 indefinitely. These have typically been 2-week phases. Again, the state has been in stage 3 since the end of June. He's made announcements every 2 weeks where we thought there was a chance we would move into stage 4, but it has not been the case. And so again, Idaho moving back to stage 3 due to an alarming rise in COVID-19 cases, positive cases, over the last couple of weeks. And it's a trend that if you've been watching our newscasts, then you've seen the 2-week moving average has been moving in the wrong direction, on the way up to levels that we haven't seen since the pandemic began some 8 months ago. And again, the governor reiterating masks. He says, wear a mask. There is not a mask mandate. We did the story last week about Kootenai County, despite the fact that their hospital is at capacity, removed their mask mandate up there. The governor saying, whenever, wear a mask. Let's go back to the press conference now and the coronavirus task force. The governor's team is also addressing the cameras. Let's go back now.
In the United States, we are entering into the third wave of the pandemic, where we may see up to 250,000 cases per day across the U.S. by midwinter. COVID-19 so far has killed more people in the United States than the past 5 flu seasons combined. Soon we will have more dead due to COVID-19 than combat deaths in World War II. 1 in 10 Idahoans is a veteran. Tens of thousands of vets receive their medical care through the Department of Veterans Affairs in our state, including at the Boise VA Hospital. 1/3 of our staff at our hospital are veterans themselves. This spreading infection not only means filled inpatient beds, but also closed clinics with staff and patients on home quarantine, interrupting and delaying medical care. Our healthcare workforce is incredibly dedicated to veterans. We strive to embody the principles of integrity, commitment, advocacy, respect, and excellence to deliver the best possible care always. The spreading infection puts them, our employees, at risk, not only to burnout, but also to catching the infection themselves. VA hospitals do not operate in a vacuum. Here in Boise and across the state, all hospitals work together to get patients the care they need. We rely on services being available with our community partners to take the best care of our vets. My grandmother in Twin Falls is currently on a 1-month lockdown in her living facility due to COVID-19. Her husband, my grandfather, is now deceased. He was a veteran, and millions of veterans like him sacrificed their freedom, future health, and sometimes their lives to protect the freedoms that we cherish in the United States. We are in a battle with COVID-19, and we cannot surrender to this virus. In Idaho, we must recognize that our actions or lack of action will result in the infection and death of our countrymen. Our veterans sacrificed for our country. We can beat COVID-19 and return to normal through cooperation and sacrifice to help keep our veterans and community members safe. These men and women are special people, our veterans. They are not just part of American history, but part of world history. They have done things like pilot helicopters through burning oil fields in Kuwait, ride tanks through the streets of Khe Sanh. They've treated and operated on orphaned Iraqi children and have felt the sun and sand of the Pacific Islands on their skin. They've been awarded medals and ribbons like the Silver Star and Purple Heart, and they've liberated people from oppression and tyranny across the globe. They are our mothers and fathers, brothers and sisters, and today many of them are elderly. They are at risk from a new enemy, an enemy that is killing hundreds of Americans every day. The rights and freedoms we have in this country were earned and paid for through the sacrifice of those who served in the U.S. military. We live in a country where you can choose whether to wear a mask because someone was willing to die for you to have that freedom. That same person who helped to protect that right needs your help protecting them. They need you to choose to do the thing that may be uncomfortable for you. They need you to do the thing that may be an inconvenient burden for your life, but to not mistake an inconvenience for oppression. They need us to do this for them, not because we must, but because we choose to. Our veterans have demonstrated loyalty to our great nation by putting their lives on the line to protect our freedoms. Let us demonstrate loyalty to them and demonstrate our respect for the sanctity of their lives by washing our hands, wearing masks, and avoiding large groups while we work toward a vaccine and better treatments for this disease. Thank you.
Thank you, Doctor, and please, your whole crew, tell them a deep, heartfelt thanks from everyone in Idaho. Now, Dr. Josh Kern, the St. Luke's Vice President for Medical Affairs in Magic Valley. Dr. Kern?
Hi, I am Dr. Joshua Kern. I'm a practicing physician in Jerome, Idaho, and as mentioned, the Vice President of Medical Affairs for Magic Valley, Wood River, and Jerome. Hazard of going third is some of my comments will be a little bit repetitive, but I wanted to give a little bit of color of what's happening with St. Luke's, and more specifically, St. Luke's Magic Valley. Even more specifically, I want to really focus on the healthcare workers that are taking care of the surging number of patients we're seeing in Magic Valley from COVID-19. Healthcare workers have been taking care of COVID patients for the last several months, and frankly, you don't get a lot of complaints out of healthcare workers. They're a resilient bunch, very tolerant of hard work, but what we're seeing right now with the surging numbers in Magic Valley is something other, and really the burden, the recent surge of patients we're seeing really may not be possible to keep up with. Our doctors and nurses are your neighbors. These are people who live in Idaho. This is not a distant group of people who are in New York or Italy, and it's not something that's happening far away. This is happening right here in our backyard. Ask one of them how things are going in the hospital at St. Luke's Magic Valley, and you'll hear that we're reaching a kind of critical tipping point. I called a friend of mine, Megan, a nurse at Magic Valley, to see how she was doing. She detailed to me the incredible fatigue that people are starting to have after the last several weeks of increasing numbers. Nurses are having to work extra shifts. The acuity or the sickness level of the COVID patients is very high, sometimes almost as if an ICU patient, but we don't have room in the ICU, so they're on the regular medical floor, and it's very burdensome. People are getting very tired, and it seems to be only getting worse. The number of patients we're caring for within our hospital right now reached a new high over the weekend and into today. Unfortunately, the number of COVID cases in the community also reached a new high at the end of this last week, which means that even if things started getting better today, we're facing several weeks of this problem. Most of the hospitals here in southern Idaho are already getting full, eastern Idaho in particular, and then Magic Valley. And when you look at the news from places like Salt Lake City or up in Montana, those hospitals are beyond full. Salt Lake City today announcing that they're looking at potentially having to ration ICU care for patients, meaning healthcare providers now have to decide who lives and dies. With surrounding hospitals at capacity and our hospitals approaching capacity, we may very well be being pushed to have those same situations here in Idaho. That's not good for our staff having to decide who lives and dies, and it's not good for the patients. The natural outcome of not controlling the virus will be unnecessary deaths and frankly, unnecessary and unfair burden to place on doctors and nurses at the hospitals. I continue to hear examples of patients or people that feel that COVID-19 is not real. Others continue to share this false narrative that people without medical conditions don't get sick or don't die from this virus. This continues to be astounding to me and my colleagues who take care of these patients, because the reality is that it does not discriminate. And we do see patients in their 30s and 40s die from this virus. Many people recover, thank goodness, but people do die. The virus doesn't seem to discriminate, and it does seem to impact people for long term. We hear about these long haulers, the persistent symptoms or long-term symptoms after recovering from COVID. There is a lot we still don't know about this virus, and that's part of the call to arms today, because we can't act like this is just some other thing that's happened before. The numbers that we are seeing here recently and around the country are unprecedented in the history of certainly in my lifetime, but I think you have to go back to 1918 to find anything comparable. And while there is so much we don't understand, there are things we do understand. Wearing masks, particularly in public, slows the spread of the virus. That at this point is unequivocal. Wearing a mask when around others stops the spread of the virus, and in fact, even more effective is avoiding gatherings where you're going to be in close proximity to people. We cannot ask for the burden of this to fall to those who are going to get sick, and we can't predict who it's going to be. It could be your loved one. We cannot ask for the burden of this to fall to our healthcare workers either. I mean, these are our neighbors, and it's not fair. I think there continues to be this false dichotomy that there's a group of people who think that there's a group that wants masks and the economy shut down and people to die from starvation and poverty. And then on the other side, there's this group of people who want no masks and to open up the economy and let the virus run its course. But I think that the middle path is the one that we need to be striving for. In the Magic Valley right now, we have businesses that are closed, locked up because all of their employees are sick with COVID. And those are businesses that a week ago did not have masks on. We heard on a press conference last week from Cliff Bar in Twin Falls that they are having significant difficulty keeping their lines running because of so many people being out sick from COVID. Wearing masks and controlling the virus improves the economy too. I'd like to thank Governor Little for inviting us to speak and give a little context of what's happening in the hospitals here. I suspect we will continue to need strong leadership at all levels of our government in Idaho and people to make difficult decisions on how to control the virus. And again, my focus is on both health and supporting the economy going forward. We must work together to achieve these ends and control the virus. Thank you very much.
Okay. Questions? Go ahead, Keith.
Governor, earlier when you talked about the healthcare system, it sounds like statewide it's just starting to collapse. That's what it seems like some of the doctors are saying. The return to stage 3, a lot of them would simply say that's pretty weak sauce, but you needed a statewide mask mandate. Why not do that?
Well, as we promised all along, the intersection of that blue curve and that red line is what's critical. For the most part, we're just knocking on the door of it, and we feel that these steps are the appropriate steps at this point in time. There are areas where the spread is high and there are mask mandates, and we're seeing the fruition of that. There's other areas, but there's not near as many as there were where we don't have that coverage. And I believe the efficacy of the mask mandate is best if it's generated locally.
Governor Melissa Davlin on Zoom.
Okay, Melissa on Zoom.
Hi, Governor. You said that you hope that we're past the point of COVID denial, but we aren't. And just last week, a Panhandle Health District board member told Kootenai health officials that he didn't even believe COVID was the cause of their hospital being at 99% capacity, and that was right before the board voted to rescind their existing mandate in Kootenai County. And he isn't the only one who doubts this. And so when it comes to intervening in these local government decisions, you've said this whole time, never say never, never say always. Why isn't this the tipping point on intervention?
Well, it's a tipping point to roll us back into stage 3, and I think a lot of it is awareness. The circles that I run in, the awareness of it is very high, but there are a lot of circles in Idaho, and that's why we have these press conferences where that awareness is not this high, and that's why we thought it was so compelling to have both the Veterans Hospital and other healthcare workers here, because in Panhandle Health, Kootenai 10 days ago they were okay, but they're not today, and so we just think awareness right now is the most critical. I hope and pray that people will do the right thing, that they'll take this advice from the healthcare experts, and literally this plea by me to where they'll bend that behavior down and we can get those numbers down.
But Governor, with all due respect, we've been hoping and praying and asking nicely all summer. And considering how quickly Kootenai Health hit that tipping point, going from being fine to being at 99% capacity, is 2 weeks from now going to be too late for some of these hospitals?
Was that a question or a statement?
Now, is 2 weeks from now going to be too late for some of these hospitals?
Well, I would, as you well know, I believe the Coeur d'Alene City Council's meeting today to address this very issue.
Governor James Dawson on Zoom.
Okay, James on Zoom.
Hey, Governor. Building off of Keith's question, the state's efforts seemingly have failed to protect hospital capacity, which was your #1 priority. Ada County has been in a modified stage 3 for months, but the number of cases here are back on the upswing. Why do you think your actions today will make any kind of a difference? Well,
I would argue that well, of course, in Ada County, there is a mask mandate. But I would argue that the incidence rate in Ada County is much better today than it would be had that not happened. And I believe just because of Ada County where it is, the awareness between the public is much higher in Ada County than it is in some of those areas where they didn't have hardly any incidents not too long ago. Clark.
Hi, Governor. With this stage 3 order being a little bit different than the previous stage 3 order, what's the main thing that Idahoans need to keep in mind with this new order, and what's the main practice that's going to help slow the spread of the virus?
Well, our epi teams, our contact tracers, as this has progressed, we know that bars and restaurants, nightclubs, where people aren't seated, we know that there's been a big spread there. And so that's why it's spelled out that everybody has to be seated. We also know from our contact tracing that these smaller events is where a lot of these transmissions have taken. So we're taking the knowledge we've gained from observation, from contact tracing, and implemented that into a modified stage 3, as you asked. Betsy.
Governor, how modified is this stage 3? For example, will visits to nursing homes and other long-term care facilities be allowed during this?
They are. The one thing we did in long-term care facilities is for those that didn't have a mask mandate, we put in a mask mandate. We always have to look at long-term care facilities about the ramifications that we saw when there wasn't any visitation. We have a lot of guidance for long-term care facilities about how those visitations should take place. Some of them have done a really good job. They're constructed such that they can keep the isolation, that a lot of it's outside. Obviously, that is going to get to be more problematic as Idaho winter approaches. But there have been a lot of changes in the long-term care facilities to where we're balancing that, being able to see and support the residents of those long-term care facilities with keeping them safe. And so they've made a lot of progression. We got a lot more testing in the long-term care facilities. There's a lot of different protocols and standards that are there that we didn't have earlier.
Governor James Dawson again.
Hi, James.
Lack of enforcement has kind of been an issue during your previous reopening. Well, we're still in that reopening plan, but there's only ever one citation ever given during the entire pandemic, as far as I can tell, related to your reopening plan. Will there be any enforcement of this, or do you have any plans to do that, or what's the situation there?
Well, I would almost argue the other side of that, James, that when we had the stay-home order, the fact that there was only one citation and there was incredible compliance with it, I think speaks well to, as long as we tell everybody why, what the rationale is and and the need for it, I think that speaks for itself that, we don't want to see a bunch of people arrested. We wanted people to modify their behavior and be personally responsible.
Governor, thanks for doing these conferences and taking tough questions, tough times. Here's one, maybe a little bit crass also. You talked about the economy a lot. It was doing well. It recently went the wrong way with the unemployment numbers. So how much of a factor is that in your announcement today?
Well, Keith, I spent a lot of time poring over those numbers. The unemployment went up, but what was interesting was the labor participation. We have the highest labor participation rate in over 10 years. And what's happened is the signal to everybody is the economy was really going. So we had a lot, even though our unemployment went up by what I thought was a lot, the number of people employed also went up. So I think it was kind of a two-edged sword, those most recent numbers. Our claims have gone down, but that's why we have to do this. That, as Josh alluded to, there are businesses closed down for no other reason than the risk of the COVID virus. So for us to continue that incredible economic momentum that we have in Idaho, we have got to have a lower incidence of spread. It's just critical. But we're still, I don't think there's any state that's really above us. There's a couple states that have, or actually I guess there's 12 states now that have lower unemployment, but our employment and our participation rate is just a signal that people are going back to work, but they will not go back to work if people are scared and if consumers don't show up. That was part of my point, that there's no separation between public safety and economic prosperity, and that's why it's so important.
Hi, if Idaho's hospitalizations keep going up, what would those next steps be that the state would take in order to combat that?
Well, we'll look at them. We have some more tools in our toolbox. We just think that given the fork in the road we're at today, this is the most prudent action, the one to modify the most behavior going forward. But there's some other tools in our toolbox. Betsy.
What are those tools, Governor?
Well, I mean, you saw the incremental, or I don't know if you have seen it. Did you pass that out, Emily? But you saw. I mean, the numbers, the size of the events, proximity, what we do in commercial operations. There's lots of other tools, and in fact, as we learn more about this novel coronavirus, we learn where the real spread is, and we want to surgically go to those areas where we know that spread's occurring and modify behavior there. At a minimum, suggest behavior modification, and we might have to do something more.
Governor, in the past week, we have heard local hospital officials and school officials around the state saying, in this crisis, the federal government has pointed to the state standard. The state has pointed to the local health districts and the local governments. And in some cases here in Idaho, those local officials have pointed back at the state. None of them have taken the steps that some of these local hospital and school officials have been requesting. So as a result, it's the frontline workers at hospitals and schools who are deciding how we're going to deal with this virus on a building by building, school by school, hospital by hospital, town by town basis, all through our state. Is this the way we're going to beat this virus?
Well, we've defaulted to state law. State law says the health districts and particularly the mayors are the ones for 100 years have been, well, health districts have only been around for 50 years, but for the 50 years prior to that, there was a designated person in each county. That's state law. You brought up the example, Betsy, of schools. There is so much difference between schools and the transmissibility that exists from one building to another. And in some instances, some of the new buildings have less distancing opportunity and less space than some of the old buildings. I don't see any way we can come up with a one-size-fits-all given the variability in schools and, for that matter, the variability. And in fact, people are more inclined to listen to their local school board and their local health boards, particularly if you get out of Boise, Idaho.
Governor Ruth Brown on Zoom.
Ruth on Zoom. Oh, that's James on Zoom. Wrong picture.
afternoon, Governor. My question is regarding enforcement. As you know, probably better than anyone, some of these decisions the community is not going to agree with. There may be pushback, there may be protests. If that were to happen, what is the enforcement mechanism for making sure people are complying with some of the crowd sizing, the social distancing, these regulations that are recommended in your order? I guess I question whether or not they are enforceable.
Well, they're enforceable, but if, you know, hypothetically, if everybody didn't comply, they would be very difficult. But we do not have a statewide healthcare police force. But as I stated earlier, look what happened when we had the stay-home order. Look at the compliance. Look at the fact that there was only one citation. A citation, I think, was an affiliation with a bunch of kids having a party, and they just cited them for that along with everything else. But it was incredibly successful. Granted, there's more COVID fatigue now than there was before, but on the other side of it, we've got elevated healthcare capacity, and as I'm doing right now, and we're all trying to do, we're trying to raise the awareness, is as you get compliance among part of your population, you will see compliance of a bigger part of it. Now, I'm not denying that there are going to be some people that will be deniers to the bitter end, but I don't have to have 100% compliance. I need to have a much higher compliance than I have today.
Thank you.
Ada County is already in a modified stage 3, and so what is the main difference between the state's modified stage 3 to Ada County stage 3? Or are they the same?
Well, I think in Ada County, and the way this works is they will, if they have more stringent regulations, that's what governs. But I do believe that probably the most helpful part of this is the fact that bars, restaurants, and nightclubs, that you won't have what we saw originally here in Boise, that an order in Boise moved behavior to Garden City or to Meridian. And so I think that will be helpful given the way that part of commerce can move readily.
And my next question, my last question, if people don't comply, if this continues to happen and numbers continue to rise, what would it take for Idaho to get pushed back again to a stage 2?
Well, I hope we don't go back to a stage 2, but I really think, you know, those of you in this room are aware of you know, the crisis that exists in healthcare, and that's why we're here. That's why I'm pleading my case before you and the Idaho public. We got to create bigger awareness. It's not that I knew a 18-year-old that got it and they didn't have any symptoms. It's that I know somebody that got it and somebody else that got it, and all of a sudden they're out of healthcare capacity, and my loved one or my friend that needed surgery couldn't get it. And we haven't seen that yet. We have been talking about it. My team over there, we've been talking about it for a long time, but now there's prima facie evidence that that can happen, and we've got to increase the awareness of that.
You talked a bit earlier about how, you know, there are some businesses that close just because their entire workforce is sick with COVID. What kind of feedback have you received from Idaho business owners just about you know, the possibility of a mask mandate or rolling anything back to other restrictions? What kind of feedback have you heard from business owners around the state?
The common denominator above everybody in Idaho is they want the spread of COVID to go down. But there's some of them that don't want any restrictions on their business. And I understand that. I'm a capitalist. I fully understand that. But everybody in Idaho wants somebody else to do something for COVID. That's why we're talking about personal responsibility and the magnitude of the problem at this point in time when we start tapping on the roof of that red line over there.
Hey, Governor, I have 3 questions for you. First one is, last week during a meeting, South Central Public Health District passed a resolution where they called on you to pass a statewide mask mandate during that same meeting. they declined to pass their own regional mask mandate. What is your message to them that they, voted to not pass their own mask mandate, but they're calling on you to pass a statewide mask mandate?
Well, as I stated twice, and I'll state it a third time, that's their job.
And then secondly, for bars and nightclubs and restaurants, if they do not enforce this, that people have to remain seated, could their licenses be at risk? What is the enforcement for bars and restaurants and nightclubs specifically?
Well, there's two enforcement mechanisms. Neither one of them do we want to utilize. We want them to do the right thing. And for the most part, they will say, if my competitors have to do this, then we'll do it. That will be the vast majority of them. But there's two ways. One of them is their food license, which the Department of Health has, and the other one is their liquor license. But I'm of the belief that almost every state around us has significant restrictions on the percent of capacity. I've really resisted that because I know the small businesses can't operate at 25% or 50% of capacity. If you look at a map around us of the West, many of them have reductions in their capacity. All I'm asking, and we know from our epidemiological studies, that if they're not up mixing around next to each other, you really minimize the spread in those areas.
And then lastly, does this move back to stage 3? Will this impact Boise State football at all?
Well, it'll be better than it was Saturday night because it'll be 25% of capacity.
Governor Benito Besa and Twin Falls on Zoom.
Okay, Benito.
Hi, Governor. Can you hear me, hopefully?
Yep.
Just look, we have 7 days until the election. Does this new order have any impacts on how the elections are carried out next week?
A good question. No, it should not. A question we got at one of these press conferences, I think about 4 or 5 weeks ago, that we asked the question that since then has been clarified, is if you've been exposed or you're positive, you need to get a hold of your county clerk, and there's provisions of law to where the local clerk, they can arrange to deliver your ballot, but there's still time to go vote at a voting center and not be amongst a big crowd. There have been resources made available to counties to better sanitize those in-person voting areas. Betsy.
Governor, you said that there's no one-size-fits-all that could help with this problem in Idaho. Yet we are hearing a drumbeat, including from Dr. Kern today, saying that there is one thing unequivocally that would significantly slow the spread of the virus, and that's if everyone wore a mask. You said it's their job, referring to the local health district, to require that, but they asked you to do it. Isn't that the one thing you could do that significantly could slow the spread in this state, is impose a mask mandate?
Well, Betsy, I believe me, I've spent a lot of time thinking about this and having discussions about it. We all know that if somebody locally asks us or tells us to do something, the compliance rate is a lot higher than it is if somebody from a higher level of government, and we in Idaho always criticize the federal government for putting on mandates. The issue isn't who does it, it's the issue I want to get it done, and I know if it's implemented at the local level, as it is statutorily, that the adoption will be a lot higher. That's my goal.
Governor, the next step that hospitals get to after reaching capacity is to impose crisis standards of care. And we already heard discussion about that possibly being about to occur in the state of Utah. If that happens here in Idaho, they will begin rationing care. Basically, we'd be leaving it to doctors to decide who lives and who dies because we don't have the capacity to treat all of them. Is there any state role when we reach that point?
Well, is there any what, Betsy?
Well,
Dr. Hahn, do you want to talk about crisis standard of care? And because when this started in March, we spent a lot of time working on that and how the crisis standard of care works in Idaho. So there have been robust discussions from the get-go about what happens there. Chris, do you want to talk about that?
Yeah, thank you, Betsy. So as you are well aware, the state has created a crisis standards of care plan. It is available publicly. Health and Welfare just changed our website like a week ago. We got a makeover.
Is there any what?
All right. Obviously, we're having some feed problems coming from the Lincoln Auditorium there at the State House. But again, if you're just joining us, we interrupted Judge Judy today to bring you the news conference from the governor, who announced a little less than an hour ago that the state would be moving back to stage 3 of the reopening plan, otherwise known as Idaho Rebounds plan. And basically, again, just to summarize, indoor gatherings, no more than 50, outdoor capacity limited to 25%. And just moments ago, our Joey Prechtel asked the governor if that meant, what that meant for Boise State, and the governor said, quote, better than what it looked like on Saturday night, meaning that they would be able to, under his plan, have 25% capacity at Albertson Stadium. That amounts to about 8,000 fans. So that is a Boise State decision that they are making, and we'll see if that changes. But in the meantime, I understand we have the feedback up. Let's go back to the state epidemiologist, Dr. Christine Hahn.
They're looking at ways to maximize resources, maybe maximize healthcare workers, bring in extra people, that kind of thing. In order to get to crisis standards of care, there are sort of a set of criteria. We have a council, CIDMAC, and now I'm going to struggle to remember what the acronym all for. The last part is it's the Medical Advisory Committee, but I'm trying to remember what. Do you remember, Elke, Sid? I apologize, I do not remember the acronym, but the CIDMAC committee, we've talked about reconvening them this week. They have not met for several months, and Dr. Whitty, who works with us, and Tamara Prysock from our licensing and certification, and many others in our department work together with this committee to put this plan together. They are going to, and Dr. Hamso from Medicaid, for example, as well. And they have had conversations over the weekend about reconvening that group to talk about whether it's appropriate to consider activating the Crisis Standards of Care plan, which would take a convening of stakeholders, a reviewing of the criteria it would take, which are in the plan. And any of you in the room today, if you cannot find it today, please let us know. Our press office can get you a copy of that. Again, I apologize because our website having been changed. But it requires some steps and kind of making sure that hospitals have really done everything they can to make sure that they have already done what they can internally. Dr. Kern already alluded to some of the steps that St. Luke's Magic Valley has taken. We know that hospitals are looking at this right now, but it would take this committee getting together and asking the state to enact the plan in order to move into crisis standards of care. Yeah.
Has the definition of probable case changed? I've heard that the results of rapid tests at long-term care facilities are in some cases perhaps being classified as probable. What does that mean at this point in the pandemic?
Yes, so the question is about the switching gears a little bit. When we report cases publicly on our website, you'll see confirmed cases and probable cases. Confirmed cases are PCR test confirmed, so this is the standard test. Probable cases are of two varieties. One is somebody who doesn't get tested at all. So a confirmed case lives in a household and other people in that household are all sick and coughing, and those are all considered probable cases, and they all need to quarantine, and they are recommended to seek medical care and testing, but they don't always, so we count them as probable cases. The other type of probable cases are people who've had other tests, antigen tests, And so you're absolutely right, Betsy. The last time that case definition changed was in August. It's on the CDC website. All states follow it, and that includes that those antigen tests are considered, if somebody has a positive antigen test, they are considered a probable case, and that's been the same since August.
And are those antigen tests, are those the type that we're deploying at our long-term care facilities? So is this becoming an increasing portion of our positive test results that actually are positive test results, but we're showing them as probable?
Correct. So they'll show, if you go on our website, you see total cases, and you can break it down by confirmed or probable. So those antigen tests, which you are probably well aware, do have problems. They're not as good as the PCR test. Sometimes they're falsely positive, sometimes they're falsely negative. So that's why a clinician really has to decide clinically if sometimes they will follow that up with a PCR test if they're not confident of the results. So a negative result in somebody who looks like they have COVID will often be followed up by a PCR test. So yes, they're considered probable because unfortunately the tests don't perform as well as the PCR. We're of course hoping for more and more better tests so that we can call them confirmed, but that is not the recommendation of CDC or the practice of any state right now.
Then why are those the tests that we're using at our long-term care facilities where the people who are in the most danger are located?
Yeah, a couple of reasons. So the question is, why are they being used if they're not as good? Two reasons. One is PCR is still our testing task force, the Idaho testing task force, still recommends if PCR can be done and is available, that be done as long as the turnaround time is less than 48 hours or so. The advantage of these antigen tests is they're faster. So sometimes if the facility needs a quick decision whether to put something to isolation or maybe consider other testing, for example, it's helpful for them to have a really quick result. But most testing, you may have seen just last week, there was a press release done by Crush the Curve. They're serving a lot of our facilities with PCR testing. We also have other labs testing other facilities for us. PCR is still the best test, the gold standard, and we still are using that for a lot of that testing. However, sometimes it's just really important to have a very quick result.
Just one other unrelated question, Dr. Hahn. What do you think of our current trends that we're seeing here in Idaho with this pandemic?
Right, very concerning. Our trends are very concerning. I think what you've heard from Dr. Wilper, from Dr. Kern, from the governor, is the trends are not headed in the right direction. The hospitalization information, which we just updated today on our website, you can see our hospitalizations rising, our number of cases reported rising. We're very concerned, and that's why the governor has taken this step. We will be watching it very carefully and hope that Idahoans do take this to heart. And as Dr. Wilper so eloquently said, to protect our veterans, as Dr. Kern so eloquently said, to protect our healthcare workers, to protect each other.
This is a question for the governor again. Thanks, Dr. Hahn.
Certainly.
Clark.
Thanks, Governor. We do appreciate you spending the hour with us. I wanted to go back to something that you've talked about several times today, and that's the idea that Idahoans don't like big government stepping in and telling them what to do, and that the compliance would go up if it was guidance coming from a more like local official, so to speak. But the thing that really has struck me is depending on where Idahoans live, they might be getting contradictory advice about the virus and about the pandemic and about best practices. And so I wanted to ask what the governor's office has done, and I'm sorry, this is a long question, but the hallmark of our government, as you know, is that it's a citizen government, largely untrained volunteers. We have a citizen legislature, citizen school board,
Citizen governor,
citizen county commissioners. You're at least paid fairly well, is my understanding, Governor. But anyways, what steps has your office, what steps is the governor taking to reach out to our legislators, our county commissioners, our school trustees, so they have this information? You've got a room full of experts here, the doctors that we've heard from. Are you reaching out to those local officials? Because we know they're getting information from somewhere. Are they getting good information, and what role is your office playing?
Well, we were on a weekly basis. Now it's bi-weekly. We have a call with all the county commissioners, with all the mayors. We occasionally have a call with long-term care facilities, the hospitals, not quite as frequently, but my team is talking to hospitals every day. And then when I travel, I was in Friday. I was in both Lewiston and Moscow. We had conversations there. I'm going to be in, I think, Twin Falls, Idaho Falls, and Lewiston this week. And I just try as hard as I can to tell people about the nexus between a rebounding economy and people doing the right thing. So I don't think anybody can be a critic of anyone in my administration doing anything in the mixed messages. We have been lockstep in how resolute we are, and I know that Sarah and Elke and Dr. Hahn are always communicating with the health districts.
Governor Melissa Davalin on Zoom.
Melissa on Zoom.
Hi, Governor. With the election a week away, a lot of the discussion around mask use has become hyper politicized. And I just checked in on that Coeur d'Alene City Council meeting that you mentioned, and it's no different there in the comments. I was wondering if you have a message to people, many of whom are in your party, who are turning this mask wearing into a political issue right before the election.
I don't think it's a good idea.
For you to say anything?
No, I don't think it's a good idea for them to make it into a political issue. I mean, in fact, and some people are whipping it up as a political issue. You know, I'm on a call with the White House. I haven't this week, but almost every week. And the White House Coronavirus Working Group is talking about everything I talked about here today, about the necessity of all the hygiene, about what we do about getting testing out to long-term care, about the efficacy of mask wearing. That is a common, and I know that if it does sell, I guess there are newspapers still, no offense, Betsy, but there are, you know, it does sell soap to talk about the delta on the political spectrum, but for the most part, every message I get from this administration is all these behavioral things that we talked about here. So I know that doesn't make the headlines. Okay, one more. Go ahead, Keith. You're the alpha and the omega.
Thank you, Governor. Talked about the overall strategy for Idaho Rebounds. It seemed like a pretty solid strategy at the start. You know, game plan to keep healthcare capacity, get the economy going until there's a vaccine. All it really relied on was people taking personal responsibility. That aspect hasn't come through. It seems like maybe most people in Idaho don't have your kind of, I don't know how to phrase it, maybe flinty rancher toughness to endure some hardships. How disappointed are you in Idaho residents that they couldn't get that job done?
Well, I'm disappointed that it didn't happen. You know, let's see.